My name is David Gealt. I'm a sports medicine physician at Cooper University Health System. I'm the Assistant Director of Sports Medicine. I'm also the Director of the Sports Concussion Program at Cooper Bone and Joint Institute. So this month is Brain Injury Awareness Month. What traumatic brain injury is, or TBI, a jolt to the head or a blow to the head where you have some violent forces, or it could be a jarring to the head, it could be a hit to the chest where it goes up and then the forces shake the head around. And that can cause some issues, or it can actually even be a penetrating force into the brain tissue. And depending on what type of injury you have, whether it be a car accident, a sports injury, or even it could be some traumatic event with a bullet or of some sort, or some stabbing or some other violent issue, you can have a lot of issues or brain dysfunction. And that can alter your cognitive issues, mental issues, physical issues. So it really depends on what kind of injury you have as far as what symptoms you get. The most common symptoms, particularly for what we see most often, is a mild traumatic brain injury, whether it be a sports concussion or little Johnny falling off the jungle gym. A lot of times you may see headaches are the most common thing, sometimes light noise sensitivity. Sometimes you may have some cognitive effects, whether it be a little slowed or trouble with concentrating, especially in school or at work. Sometimes you can have balance issues as well, but we also do sometimes see emotional issues as well, whether it be depression, anxiety, sometimes trouble sleeping, sometimes trouble organizing everything together in your hectic life that you already have. So it really depends on each individual, on how they got hit, where they got hit, what kind of symptoms they're having. And we do find that sometimes if people have some underlying medical issues beforehand, that sometimes can muddy the waters or make things a little, or prolong the symptoms, whether it be if they've had a history of concussions, if they have a history of depression, anxiety, if they have a history of migraines, that's a big factor too. So sometimes depending on if they have underlying issues, that may be prolonging some of the symptoms. And we do find with some studies that females are sometimes more prone to having migraines, so sometimes we do see that, and that may prolong some of the symptoms. Sometimes we also may feel that sometimes with hormonal issues or changes that also can affect treatments and recovery as well. With kids, we do find that it sometimes can take a little bit longer for some symptoms to recover completely. It depends on what kind of symptoms they're having, but it's not a cookbook guideline where we treat everybody the same. It's different for each person. That's why at Cooper in particular we have a good team here of a multidisciplinary approach. The more mild traumatic brain injury, which I see a lot of with sports injuries, it's usually temporary, where you have some cognitive dysfunction. Sometimes you may have some other symptoms, whether it be headaches, dizziness, blurred vision, concentrating issues. But that usually does resolve over a period of time and it does go away. Some more serious injuries, you may have some more permanent effects, and sometimes you have some other rehabs that you may have to go through. As well as if you have penetrating trauma, sometimes you also have to involve surgical intervention as well. Anybody is affected with brain injury, that's what's actually important for us to educate everybody about. It can be very life-altering, obviously, not only for the patient but also for their family. Things can just be turned upside down, and that's why it's really important to make sure that we have a lot of support and education about what brain injury is, and then also have the means on how to treat people. It's unfortunately not a quick fix for certain issues, and especially if it's more severe or significant brain trauma. Sometimes you do have some life-lasting cognitive issues or physical ailments that you may need further care for. How we treat it, again, depends. It's a whole gamut from conservative measures through the non-conservative measures, especially if there's any surgical intervention that's warranted. But it's usually a multidisciplinary approach. That's why with Cooper, we actually have a great program here where we have whether it be sports medicine physicians, neurologists, neurosurgeons, physical therapists, neuropsychologists. It's really, it goes across the whole board as far as how we treat it, depending on, again, the symptoms that you see. So again, education is really the most important thing, knowing what a brain injury is, and then knowing about what avenues to pick from so that you can get treated properly.